Welcome, everyone, and happy International Women's Day. We're going to wait for a couple minutes for people to join us. But while we're waiting, if you go down to the bottom of your screen, you'll see interpretation, and you have the opportunity to choose either English or Spanish. Please do so, and we will get started in just a couple of minutes. So glad you're here with us. Hi, everybody, and welcome. I just want to say hello again and to ask you please to look at the bottom of your screen. Under interpretation, you can pick either Spanish or English because we want you to be comfortable listening to and sharing in the conversation today. We'll be starting in just a couple of minutes as our audience arrives. Thank you for being here. Well, welcome, everyone. I think we'll begin this wonderful Women's Day. It's so nice to have you here, and we know it's a busy day, especially just as CSW 67 is getting underway. Just a word first about interpretation. If you want to listen to this conversation in either Spanish or English, please look at the bottom of your screen and click where you see the word interpretation so that you can select your preferred language. Thank you for doing so. We want you to be able to hear and understand and share in the dialogue today. So welcome again. My name is Susan Blaustein, and I'm the founder and executive director of Women Strong International, a global nonprofit that funds and convenes local women-led NGOs around the world, helps them build their capacity, build a community, and share their knowledge with each other within their cities and countries, and on a global stage such as this one. Our 21 grantee partners, 3 of which you're going to meet in just a moment, work in the areas of women's health, girls' education, economic security, and preventing violence against women and girls. We bring them together in our learning lab where they have the opportunity to share strategies, air frustrations, and collaborate on publications and public events like this one, prepared for you here on this momentous day. Today, our discussion is focused on expanding access to sexual and reproductive health services, which we know are far less readily available to women and girls in low and middle income countries. When we consider the lack of education opportunities, of mobility, and of access to the internet in so many parts of the globe, we wouldn't necessarily think that digital platforms would be a particularly fruitful way of reaching more low-income girls and women with information and of succeeding in getting them to utilize these services. Yet, as shown by our panelists today, all of them leaders at local women-led nonprofits, digital platforms and the digitization of life-saving outreach and services have been absolutely remarkable, potentially even revolutionary. The pandemic lockdowns, of course, and so many organizations' inability to conduct their usual reproductive outreach were a trigger for the acceleration of this uptake and the increasing sophistication of the information and services provided. Today, we get to hear from 3 pioneering providers, all of them Women Strong partners, in the Philippines, in Mexico, and in Zambia, so on 3 continents, about what they've done, how they've innovated, what they've learned, and about some of the challenges and opportunities that lie ahead. I'm thrilled now to introduce you to our moderator for today's conversation, who will introduce you in turn to our esteemed panelist. Dr. Lizelle Lifshitz serves as Executive Director of Mujeres Aliadas, one of our 2 great Learning Lab partners in Mexico. Based in Michoacan in southern Mexico, Mujeres Aliadas trains professional midwives, advocates for women's full sexual reproductive rights, and supports adolescents and women, in the organization's own words, by strengthening their autonomous decision-making process and self-care in relation to their bodies, their sexuality, and their reproduction. Dr. Lifshitz herself has worked these last 30 years in the private sector, in public administration, and in civil society as a founding member of the women's collective Vuva Sapiens, and as a board member both at the Morelia Center for Buddhist Studies and at Mujeres Aliadas, which she now leads in a hands-on capacity, and where she and Ana Mahana, one of our terrific panelists to whom Lizelle will introduce you in a moment, work closely together. So Lizelle, everyone, a warm welcome to you. And now over to you, Lizelle.
Welcome participants, welcome panelists. Thank you for joining us from all over. If you haven't already, please chat with us and tell us about yourself and where you're joining from. So regarding some logistics, for the panelists, please be reminded to mute your mic when you're not speaking. And participants, please note that we are recording this session. And remember that we have interpretation to Spanish for this seminar, so you can just click on the language button below in case you want Spanish interpretation. So bienvenidas, bienvenidos. You can insert questions at any time in the chat and we will ensure to ask the panelists. So to start warming up today, I invite you all to join the Slido link in the chat and answer the question that is there regarding what's a great digital health innovation from your country that you are excited about. We want to know what's going on in other countries before we share. Okay, so there's a link at the chat box and you can answer there. Okay. We don't have answers yet. La pregunta en español es, ¿cuál es una gran innovación?
The question in Spanish is, the question is, what's a great digital health innovation from your country that you're excited about?
Okay, while we get some answers here, I'd like you to open a bit the stage for our panelists. We are in a context of global crisis. We know that we face similar issues in the global south, issues like poverty, natural disasters, lack of access to health and water, war, conflict over the globe. So a common thread across all is the magnification of gender inequalities, denial of sexual and reproductive health rights for women and girls, violence, and other injustices experienced by women in affected communities. Countries are still coping with the prevention and response to COVID, and as feminist organizations, this is the context in which we find ourselves. Once again, tapping into our resilience and creativity to keep the work of sexual and reproductive health rights moving forward. Today, we will discuss how digital technology can aid in helping to connect. So, we have an answer here. using reels to reach adolescents. Okay, we will talk about this in a while in the experience from Mexico. Thank you for that. Okay, so this has to do with the first panelist that will be here with us, Zambia. Okay, we have another question here. Your share is seemingly promising in Zambia for sexual and reproductive health and rights, but it's still being tested. Otherwise, we don't have much in that space digitally due to poor access. Less than 32% of people have access. Yeah, access is definitely an issue in our countries. So we will be discussing a bit more about videos, shorts, access to internet in different ages. So I will briefly introduce first Ana, our first panelist. I will do that in Spanish. So Ana es la directora del programa de
Ana
adolescentes.
Magana is the director of adolescent programs of Women Strong, partner Mujeres Aliadas. She is a menstrual educator. She is member of the Red of Campañantas de la Meseta Purepecha, and she's also a companion of women fighters and defenders of the rights of women, adolescents, and girls. Ana, I would like you to please introduce yourself and that you tell us about the work of Mujeres Aliadas, why you like working there, and what are the challenges faced by indigenous communities in Mexico when accessing digital platforms. How do you overcome in Mujeres Aliadas these challenges? Thank you. Well, hello, everyone. I am Ana Magaña. I am from Michoacán in Mexico. I've been working for some years already in Mujeres Aliadas. What do we do as an organization? Well, we advocate for the sexual and reproductive health and rights of women. We are also defenders of the rights of women, of girls and adolescents. And in Mujeres Aliadas, we have 4 active programs. The first one is a health house, which is led by professional midwives, which use their traditional knowledge. As Susan said at the beginning, we have a midwife training school also, in which we train the future midwives that will be part of the birth of many children. We have a third program, which is a community capacity building program. Here we work with adult women and we carry out workshops relating to SRHR and bodily autonomy, and also the defense of the rights of women. And then we have a fourth program, which I lead, which is the Adolescents Program. Here we have workshops for primary school and secondary school students, and also other independent groups that come from rural communities and indigenous communities where we worked in. Why do I enjoy working in Mujeres Aliadas? I really enjoy my work because I can really work closely with children, with young women, and I really like being able to giving them support and tools for them to access to SRHR services that are quality services, but they also can access them for free. And I can also actually create networks with other colleagues that work with rural indigenous communities. I also really enjoy giving people new opportunities to live, women, adolescents, and girls, giving them opportunities, new opportunities to live. That being said, I'd like to share some things with you regarding the challenges that we face here, that the youth faces here when accessing digital platforms. One of the main obstacles is our lack of access to the internet. We don't have access to the internet in all rural indigenous communities. Of course, now, because of the pandemic, the type of learning has shifted a bit. In many places, we were forced to introduce the internet because we could only learn by actually accessing digital platforms. So a lot of places had to have an internet connection installed. Because the problem with the access to the internet is not only that the connection does not reach everywhere, but also that not everyone can pay for it. Because the internet and the access to it is actually very expensive, mostly in remote areas. So this is still difficult for us. Of course, there are adolescents and children who have access to these digital platforms. However, they are still a minority. Most people have it difficult and find it difficult to access these services. We then, as a challenge, face the cultural context. So, indigenous communities have many customs and habits, traditions. So there are very enrooted challenges that make some things taboo. So, for example, in traditional societies, we have gender norms and social norms, but in indigenous communities, we have them too. And we also have other norms that are very much intrinsically linked with their traditions. So, gender norms stem from those cultural practices. So, women are allowed to do certain things, whereas men have more freedom to act. This takes me to a second point. Adolescents are not really interested in their rights in general. And I'm talking about all kinds of rights, not just sexual and reproductive rights. Why? Well, because it's very difficult to have an interest in something that we know nothing about. And why do we know nothing about? Because no one talks about them, because they're taboo topics. I'd like to share, for example, there was this one time that we were having some workshops at a secondary education school. And I was teaching a workshop on SRHR. Within these rights, of course, you know that we have the right to express our emotions and that we do not have to have sexual desire only towards the opposite sex, but that we also have other possibilities for our sexual encounters nowadays. So I was talking to the students back then, and one of the teachers, female teachers, just told me, "Stop, I do not want you to keep telling them this information because they are my students and we're going to leave." So in order to not start a conflict or a fight with this teacher, I just said, okay, that is fine. However, I did give them some flyers so that in case they had any questions, they could reach me. I just told them that I would be there until they left home. So in this way, the teacher cannot just stop them from getting the information because she was actually going against their sexual and reproductive rights. Afterwards, we can talk with coordinators and managers, and we actually did, so that they talked to the teachers and so that she knew that she was going against those rights. So next slide.
Ante estas situaciones a las cuales nos presentamos y también
Facing these challenges and facing the pandemic, because we were struggling with this pandemic working from home, what we saw is that our work is done collectively. We work with the communities, we reach out to them, we go and talk to anyone that requires any kind of workshop, anything related to the subjects that we talk. So when we talk with the pandemic situation, we had to stop because we couldn't simply move. We had to avoid this physical contact. So we had to find different approaches in order to reach out to the target audience, which is the teenagers and young adults. So what we decided was to develop a character that would be able to do these subjects on a social media. Here you see on the screen Purpurina, which is the character that we developed, and it's the feminist conscience of a teenager around the 14 or 15 years old. And here's where we see that life is seen from a different point of view and how we can start questioning how we see ourselves. We were able to make 2 seasons of Purpurina. Each season has 4 chapters, and each one of these chapters talks about a different sexual and reproduction right, done in a different way in each episode. Because if we try and find anything related to sexual rights online, you're going to see that you don't always find resources or material that are actually fun, not just informative. So this allows us to express ourselves, and how can we defend this HR right in this very violent environment that really rejects this point of view. So this is why we developed these seasons of Purpurina, and each chapter is a little bit long because we really try to develop the content in the best way possible. And doing this, we started seeing that this wasn't the best choice if we wanted to retain the attention of all the teenagers. Of course, despite of this, these videos actually help us, and we started seeing a great influx of visits. But in this case, it was actually from teachers and parents that are actually very interested in the content that we were using and displaying on these chapters, because even then, despite being adults, they actually didn't know about it. It's interesting to see how not just the teenagers, but actually just adults are unaware of the content that we were sharing. So that's how we started seeing the teachers and the young parents what is the content that we're saying, and that made us realize, okay, our efforts were not in vain. So we were able to reach out to many households, but we're still not able to approach the teenagers, which is our target audience. So doing a lot of researches, a lot of intrusive investigations, and getting a lot of counseling. One of the counselors who helped us were the amazing team of Women Strong that allow us to make new strategies to be able to reach that. And one of the things that we made was to make of short videos or reels in different platforms so that we can start getting that audience. So if you are able to retain the audience of these teenagers, you have to understand that you're only going to do this if you keep videos within 1 minute, because that's the attention gap of them. You have to make certain to make this video have the content that you want in that video, and let them know that if you want to know more about what is being said, we invite you to the platform in order to see more about these topics. Another thing that we were able to do in order to reach the teenagers was the reinforcement of the networks using community leaders, especially women. And not only women, but also some young adults or young teenagers that don't identify themselves within the binary role. They are part of like the LGBTQ plus community, and I don't identify in a gender role. But having these leaders allowed us to promote these videos better, but not just that, they were performing the role of accompaniment in order to do these roles of leaders in these platforms, because a lot of these community leaders started using these platforms as a way to be able to express or even just denounce the situations that are being presented in the communities that are not always shown. Something that is not commonly allowed to be said in social media, we can actually do it here in a more free way. And this has allowed these community leaders to be able to have access to these platforms in order to show and make evidence of the situations that are going on that the community are not always allowed to mention. Another solution that we were able to figure out in order to retain the attention gap of the teenagers was to created names and alluring names within the contents, trying to make our content not as usual, typical, or average. We're not just saying, oh, sexual rights. We want to tell you about instead, like, what are the fundamentals that we're talking about this? Why is this interesting? We try to make it something that is interesting for them and create names that we're able to say the content, keep the attention, and also help us to be able to contain the videos in the digital platform, because if we just put a name that is not allowed in the platform, we have to understand that the reality is that the platform are just not going to allow it. We have to understand this, and we have to work with the algorithm that this each platform works. So if there's any specific word, keyword, or buzzword that the system doesn't allow or create a shadow ban, that video is just deleted, blocked, or it doesn't allow it to reach the community that we wanted. So using these specific keywords or creative words in the videos help us to be able to retain the video, to not make it censor, and that the algorithm doesn't just block it from the audience we want to get. And this is why you see in this image the title of Ni huele ni duele, which means it doesn't smell, it doesn't hurt. And this specific image speaks to the video that actually correlates to menstruation. Why do we use it like this? Because if we have a video that has the word menstruation, every platform is just gonna block it. And we started seeing that in YouTube, no one was actually getting views, or the videos were never getting any more than a couple of views. So we started thinking, why is this going on? It's one of the videos that we put the most effort. Why is this video not getting the views? And then we realized that it was blocked because it had content that was censored. And even though we wanted to reach a specific teenager, the content was not allowed for them. So we don't agree with this. We don't like this algorithm and the way that they work in YouTube, because it really censors the work that we do. It censors the information that is not only helpful, but required and needed for the life of these young adults, teenagers, and parents that require it. So being censored is very damaging. This information has a lot of research and it's really unfair, but this is where we have to start seeing what are the new possibilities and options to share these contents with the teenagers. Thanks a lot, Ana. I see that just like in Mexico, there's a lot of difficulties of access, but we see that the patriotic system is also making the struggle in different areas. Thank you, Anna, for reminding us of the importance of speaking in a fun way, even though this could be an awkward conversation. We need to keep this conversation going over and over because it's really important. So thank you for that.
I will turn to English now and present our next panelist. This is Faith. So Faith Keoma is the co-founder and chief operations officer of Copper Rose Zambia, with more than 30 full-time staff and over 500 volunteers. The organization is a nation's largest youth-led organization that promotes sexual and reproductive health and rights awareness, menstrual health management, youth leadership, and economic empowerment. So I will turn the next question to Faith. So Faith, can you please tell us why you like the work you do? And in what ways can digital platforms be used to increase access and utilization of sexual and reproductive health services for youth and young women in your community? Over to you.
Thank you so much, Lisel, and hello, everyone, and thank you so much for joining us this morning, afternoon, or evening, depending on where you're joining us from. So I'll just start off by sharing a little bit about Copper Rose Zambia, and then I'll get into pretty much answering the question on how we're leveraging technology and digital platforms to improve access to sexual reproductive health. So Copper Rose is an organization, the largest youth-led organization in Zambia, and we are creating a conducive environment for young people and young women to thrive in all aspects of their lives. And as an organization, we envision a world in which every young person is happy, healthy, and living to their fullest potential. So coming back to the room and the focus of this entire webinar, we are currently at CSW, even if we're joining virtually in this session. And the theme that we are convening under for CSW is innovation and technological change and education in the digital age for achieving gender equality and the empowerment of all women. So bringing it down to the purpose of our convening and this webinar is we're trying to figure out how could we go digital. And if we are interested in actually ensuring that quality sexual reproductive health services are available for young women and young people, how are we jumping on the bandwagon of incorporating technology? So before I get into sharing about Copper Rose and how we are improving access to sexual reproductive health services for women and young people, allow me to just run you through some brief background and statistics, which will show you the country's population and also the status of our digital penetration. So as a country, we are standing, in terms of population, we are currently at 19.2 million people. This is as at December 2022. And the average age for Zambians is about between 17 and 18. To be precise, 17.9 years is the average age of Zambians. And of this population, 51% are women and 49% are men. Already you can see that there's not exactly a balance there. So taking it to the settlements and the distribution of where this population is, we have 45% of this population in urban areas, meaning they have access to quality education, they have access to healthcare services, they have access to information, or at least are closer to where all of the economic opportunities and all of the economic hub of the country is. And 54% are based in rural areas, which means they may or may not have access to basic needs of life, such as water, access to clean water, access to quality healthcare, access to education, access to food and proper nutrition. So when you think about these statistics and you now start to think about, okay, if this is the way that settlements are distributed and the way that the population of the country is distributed, how then can you infuse technology, and how then can you ensure that there is equality in the access of the services that every young person, every young woman needs in order to access sexually reproductive health? So now bring it to the digital penetration of the country. And to be honest with you, the numbers are quite scary. We have 28% of the entire population. So remember the 19.2 million people. So only 28% of the entire country has access to the internet. And of that 28%, merely 14% of adolescents, merely 14% of that population are adolescents. So automatically it rings a bell that it's quite limiting, and it limits abilities of organizations, not just Copper Rose, but like corporals who are interested in ensuring that there's improved access to sexual reproductive health for young people and young women, are pretty much, reduced, or are pretty much not as effective or scalable due to the digital penetration. However, we have been creative and we have found ways that we are working around these statistics, even though they seem quite troubling. So I'll share with you some of the few things that we are doing as an organization in partnership with Women Strong and many other partners, both locally and internationally, to ensure that we have access to quality sexual reproductive health services for young women and young people. So for starters, we've understood that as a country, due to our suppressed or low access to the internet, traditional means still apply. For example, radio and TV are still primary sources of information sharing and information and receiving of information. So we are still working with, we do work with institutions that provide information on such platforms. So we have radio shows, active radio shows, where young people share accurate information about sexual reproductive health services, where to receive these services, what kind of services they should receive, what rights they have for starters, and how they can be more accountable, how they can ensure that the government is more accountable to the demands that they've set out to do. So specifically, we have programs that touch on self-care, HIV prevention, and the broader sexual reproductive health umbrella, and just sharing real-time information with other young people. And these programs are led by young people. So in order to capture the number of people that are listening or watching, as you might know, radio and TV are quite limiting with regards to understanding how many people of those who are watching are either young or are women. So one of the ways that we are supplementing the efforts to understand what the statistics are saying is incorporating things like watch parties or listen parties, where in the areas where we work in, we bring young people together offline, play the radio show or watch the TV show, and there we're able to have follow-up discussions after the show to share what their reflections are in real time, share what they think, could be incorporated in future shows, but also at the same time have access to information from experts, other young people who have either understood the program or, other older young people who can be able to provide experienced information, whether it's being from their academic background or being from the type of work that they're doing. And this happens in our active areas and through our youth-friendly spaces. The second way that we're leveraging technology is through social media. And we've been using social media platforms, of course, the known social media platforms like Facebook, Instagram, TikTok, and Twitter to reach young people on sexual reproductive health. And in order for us to make them keen about different campaigns, we're also carrying out competitions where young people respond to various questions regarding information we share with them on social media. And those who get the questions correct are given prizes just to, increase their motivation and also encourage them to share this information that they have with other young people. And young people take advantage of these platforms because it's a way that they can reach us as well. And it's a way that they can share or ask questions to us. And for the problems that they experience where our services do not cover, we are able to facilitate referrals to other organizations or other institutions or health centers where they can be able to access direct services. And finally, one way that we're also leveraging technology is through USSD platforms. So in Zambia at the moment, there's a platform called U-Report. It's a USSD-based platform where young people and young women have access to information on their sexual reproductive health. And this U-Report also sends direct messages to those who have subscribed, just to update them on what is trending in sexual reproductive health and what young people are supposed to do when faced with any sexual reproductive health related challenge. And this also provides opportunities for young people who have had access to this USSD platform to create informal WhatsApp groups where they can share further information based on their experience. They could also share information based on the kind of service they've received. They can also share information based on what they would look forward to at their next maybe health visit or hospital visit, and so on and so forth. Of course, there are many, many other ways, but one of the things that has primarily worked for us has been working with already existing platforms, because that way we're not reinventing the wheel, and also we are making the services more accessible to young people. Because, for example, we have the access to internet from the telecommunications company, for example, would give you a cheaper bundle, like internet bundle, if you're using social media versus if you're using like a web page or a mobile app. So leveraging technology in improving sexual reproductive health services should definitely start from using already existing platforms. Thank you so much, and back to you, Lisel.
All that you do at your country. So we can see that as in other global South countries, Zambia also faces difficulties in access, not only to internet access, but also to basic needs, to information and health services. So thank you for proposing this use of a variety of media to share messages, social media, radio, international, and already existing platforms. So thank you for that, Faith. I will now present our next panelist. This is Amina Evangelista. She is the founding executive director of Roots of Health, the only reproductive health organization operating in Palawan, Philippines. Amina worked at Human Rights Watch, was a Vital Voices Lead, Global Ambassadors Fellow, and Equity Initiative Fellow, and an Asia 21 Young Leader at the Asia Society. She has a much larger resume, but this is like just a brief version of it. So Amina, please free to share a bit more about yourself and about Roots of Health. So, and the question for you is, how do you work with key stakeholders, including government, youth, and community influencers, to improve the quality of data collection in order to form sexual and reproductive health services? Over to you.
Thank you so much, Lisel, and thank you to Women Strong for organizing this panel, and to everyone who has joined us, and to Anna and Faith for the really interesting learnings that you've already shared. As mentioned, I'm Amina Evangelista Swanepoel. I'm Filipino-American, and as mentioned, I started a reproductive health organization called Roots of Health in Palawan in the Philippines 14 years ago. To why I do this work, I believe in the rights of women and young people to live healthy, fulfilled lives, and saw that a lack of access to information and to services were leading so many Filipinos to have poor reproductive health. Unplanned pregnancies, especially among teenagers, rising HIV incidents, and preventable maternal deaths are all problems in the Philippines, and these problems have solutions. So my organization provides people with information about their bodies and their health, and we also provide clinical contraceptive services, and we support our government stakeholder partners so that they can also improve the programs and services that they're giving to support reproductive health. And so to the question for this panel, part of the support that we give to our partners is to help to improve the quality of the data collection to inform sexual and reproductive health services. At the moment in the Philippines, for data collection, health workers or surveyors go house to house and collect data using pen and paper. Once the paper surveys are complete, they have to wait until somebody else encodes the data or types it up into a spreadsheet. By the time the data are at a stage when someone could do analysis on it, the data are outdated. And even if they're not, very few people do analysis anyway, because the volume of the raw data can be so overwhelming. And many of the people involved don't have the expertise in data analysis. And of course, as those of us who do public health programs know, accurate and timely data are crucial in planning any government programs. And so we've been really happy in the last few months because the city government of our home city, Puerto Princesa, recognizes the value of having this timely data, and they partnered with us to develop the city's first responsive household database called the Comprehensive Household Information System, or CHIS, or in the Philippines, we call it CHIS. This web and mobile app helps to streamline the collection of relevant information at the household level across government offices and departments, and it prevents resource-consuming duplication of effort as well as data inconsistencies. It also differentiates between households and families within the households by assigning QR codes to households and families independently, so that even when families move, their data can be picked up and reassigned later, which will save health workers a huge amount of time. Now, the work that we've done on this is not revolutionary, but what we found is that most big data systems are designed using a top-down approach. So while we're excited to see what program managers can do with accurate data, we made sure that the system worked for the people collecting the data. Health workers are usually the ones tasked with data collection at a community level. And most of the time, once they send the data up the line, they never see it again. The difference with our solution is that the data are available at the local level, so the health workers can immediately see the needs of their communities, and their village leaders can also see it and plan effectively to make sure they're meeting the needs of their communities. After being trained on how to collect the data on mobile devices, and having realized the power of the system, many health workers that we've trained have gone out after hours and on weekends to ensure that their entire barangay or village has the data in the system. This is really a fantastic opportunity for us to enhance the collection of data related to gender, and it allows government and civil society organizations like ours to better allocate resources and design programs to address inequities. The initial interest for this system came from health and disaster response departments at the city level, but village leaders have become the key drivers in our system's development and uptake. They were so excited once they saw the reports and realized what they could have at their fingertips that they actually got together and formulated a local law to fast track the implementation of the system at the local level. And this is why we're now piloting and debugging the system as fast as we can so that we can train more government health workers in collecting this data, and we can roll it out in more places this year. So soon, more than just our local government will have accurate, timely information on gendered information that doesn't usually get collected, like women-led households, which households have pregnant women, which households have people with special needs, as well as whether women in the household have an unmet need for contraception. Once we have the data collected, we can analyze these to better design programs for women and for young people, targeting the gendered needs that they have identified from the surveys. And this includes ensuring access to sexual and reproductive health care services, access to contraception, and access to education programs for young people who might have a higher risk of unintended pregnancy. Having this data will allow us to be much more targeted. For example, we'll be able to identify villages that have high unplanned pregnancies and have unmet need for contraceptives so that local government, as well as our organization, can prioritize interventions and funding in these particular areas. As recent pandemics and disasters have demonstrated to us, having a responsive local government is crucial to health and well-being. During COVID and after a recent typhoon in the Philippines, the government struggled to create a list of those who needed assistance. Even once the list had been created, there were problems with how households and families were counted, and there were issues on eligibility and perceived favoritism. And these, at the community level can lead to conflict and can exacerbate dire conditions that are already existing on the ground. With CHIS, or CHIS, the list of who needs support would only be a few clicks away, and this would allow help to be mobilized significantly faster. It's also worth noting that the data would be stored in the cloud. So, often with disasters, if the data is in pen and paper or stored in an office, if that gets destroyed, then again, there's no backup information. So in this way, when families know that the data is accurate and collected and managed in a professional manner, they're more likely to trust it and focus their efforts on community building work that strengthens social cohesion. With our comprehensive explanations of this system, households are very well informed of the aims and the benefits of CHIS and how they're identified to be eligible for certain government programs. We're really so happy that CHIS is a real-life example of how digital platforms, if crafted with the right intention and if designed to actually ease the burden of users, can improve the lives of women and girls and impact communities in tangible ways. For many local leaders and resource-poor families, technology might have seemed so inaccessible or inconsequential to their daily lives, but we're glad that they now appreciate its value and its promise and are actively engaging with digital to take care of each other and to build their communities. I'm happy to answer any questions about this or talk about any of our other programming. We have some similar programs to reach young people, as Anna and Faith have also described, but I'll stop for now. Thank you.
Approach of identifying a public problem and then finding solutions that take into account both community building and technology. That's a very nice approach to improve the lives of women, girls, and communities as a whole. So thank you for your explanation on this. So thanks also to the participants that have comments in our chat. We've seen different approaches to technology for addressing sexual and reproductive health and rights. So now let's hear some questions from the audience. So we've got some already, so please feel free to answer, to have your questions in the chat. Okay, I have one for Amina for starting. It's not actually a question, but there's a comment from Raisa Beltran regarding how to use machine processing by computer scientists to predict health behavior risk in academic spaces in the US. I find it that it has some relation with what you shared before, Amina, so maybe you want to briefly comment on that.
Yeah, thank you. And hi, Jem. Hi, Raisa. Thanks for that comment. I think that's so interesting, and I would really love for that kind of technology to also be available in the Philippines and in other places where it's not currently used. I think it's really fantastic to be able to use that kind of technology to kind of predict, who might need more support. And for us, I mean, it's not that high tech for us yet in the Philippines, but during the pandemic, we were able to do some teen pregnancy research that found there were some situations that a girl could be in that might lead to a higher risk of having an unplanned teen pregnancy, including if an older sibling had an unplanned pregnancy, or if she was in a single-led household. And we were able to take that data and, when we were recovering from Typhoon Rai or Typhoon Odette, we targeted communities, within the communities, we targeted single-led households because of that data. And it's the same kind of idea of using tech, using research, using data to figure out who might need this extra support and to be able to just target that a little bit better, which, as all of us who work with nonprofits know, you have to really take care of your resources and try to have the most impact that you can. So I think it's really fantastic to see developments like that.
Collect it and let's make the best of it. So I have another question for Faith. So Faith, how do you engage youth in the design in your sexual and reproductive health and rights messaging in WhatsApp or radio campaigns?
Great, that's a great question, Lisel. Thank you so much. Well, there are multiple ways that we do engage young people. I think I'll share the key areas that have proven to be beneficial and also have been a mutually learning experience. So for starters, before we start any programming and before we start, especially programming that is supposed to be sharing information to young people by young people, we conduct a needs assessment situational analysis just to understand, okay, what are the areas on the ground? What are the gaps? And how can we ensure that we are addressing the gaps instead of, just shooting in the air? So we do this through things like baseline surveys, focus group discussions, as well as individual interviews with the direct beneficiaries themselves. Another way also is, once we understand what the data is saying from these sessions, we do conduct a co-creation of messaging with either the peer supporters or young people who will be sharing this information with a group of young people who would either be beneficiaries or representatives of the potential beneficiaries of this information. And through this exercise, we're able to understand certain things that maybe might be, for example, we are currently in 8 out of the 10 provinces. So not all the interventions or all the messaging work exactly the same in all of these 8 provinces. So having this, this co-creation session allows us to ensure that we are tailoring the right messaging and we have representation from the, exact population, as well as we incorporate ensuring that there's use of youth-friendly language and visuals. So on one of our projects where we are promoting the use of self-care in order to reduce HIV prevalence, we have a specific Facebook page called MySpace. You could look us up and like our page. And on this platform, we're very informal with our target audience. We're very informal with our priority audience, and just to ensure that there's that engagement both in the chat of this, of whatever posts are made, and also in ensuring that there's information is flowing on both ends, and it's not just, us talking at people, but it's a conversation. And the chat box, or rather the comment section of those posts, are usually very, very engaging. So yeah, use of youth-friendly language, ensuring that a needs assessment is conducted, and co-creation of messaging are some of the strategies that we've used to ensure that young people are part of the design of these messages. Oh, sorry, Lisa.
No,
Looks like
estaba apagado mi micrófono. Gracias, Faith.
Sorry, my mic was turned off. Thank you, Faith. What you're saying really has to do with what Ana was telling us about her experience in Mexico, where there are different target audiences, they're both urban and rural, there are different contexts. So I'm going to ask the next question to her. From your experience in working with technologies to offer services to children and adolescents, how do you work with the gender gap so as to ensure that everyone is included, so that all your efforts are inclusive in Mexico? Well, I think we support each other, also together with community leaders, so that both genders are represented in these activities. Because when creating content, when posting it to social media, we never know who is going to see them most often, whether they're boys or girls. So of course, thanks to the statistics of these platforms, we know who is able to see our videos, who have liked them, and we've seen that girls are the most interested in these topics. So we've had to develop a series of strategies to attract the attention of boys and or of male adolescents. A bit different is what happens with children. So these we were talking about in social media where older children, so teenagers or adolescents, but now with children is a bit different. It's easier to work with them because they don't really have that big of an influence from the adults yet. which is different to adolescents because they are in the adult world already in terms of the topics they talk about, in terms of violence, and other issues that go against SRHR, but with children, both boys and girls are interested in the issues that we talk about, issues that socially are targeted towards either girls or boys, usually, but for children, they don't really see that distinction. So that's how we work with them here in Mexico. Here we have topics which are more, they're better seen for, or they're technically regarded as more interesting for girls than for boys, for example. And this is just because of gender inequality, of course. And that's why we're working on this topic with mixed groups, with boys and girls together in a group. And of course, this is difficult taking into account the cultural context. For example, when talking about menstruation, there are many girls who don't want the boys to be there, or they don't want a male adult to be there because they feel shy about it, they feel ashamed, or they don't want to ask anything about their own body. They don't want to ask about where the vulva is. Even when you say vulva and penis, they do show a reaction. Both boys and girls just become very shy about it. So I think that actually having spaces where boys and girls can be together is very useful, because the access to information is different for boys and girls, because girls are usually, they're used to getting this kind of information in private spaces, for example at home. But of course, we have to change this in order to advance in gender equality. Of course, we can talk about these issues privately, of course, but we also have to talk about them in groups with both boys and girls. I have to create a space in which I'm not ashamed of talking about my body, in which I can just talk about my reality as a woman. And of course, for boys too, so that they are not ashamed or shy away from talking about their penis or their body just because of the fear of how people are going to be reacting. But of course, this is a gradual, slow process. Of course, we're not going to force anyone, no students, neither boys or girls, to talk about these things if they don't feel comfortable with it. But having videos on digital platforms has really helped us be more comfortable when talking about our sexuality and our bodily autonomy, and also our sexual and reproductive health and rights.
You have commented about censorship of some of your Purpurina videos, but there's a question regarding censorship challenges. So maybe Faith or Amina, have you had any experience also in being censored for some contents?
Faith, I'll just jump in. But yes, we have definitely had these problems because I think the algorithms and the rules that a lot of social media platforms have, especially our experience has been with both Facebook and TikTok, is they flag content that has sexual and reproductive health, mentions of certain words or that are about certain topics. And also when we're trying to target certain audiences, if something has to do with sex, you're not allowed to target minors under 18, which of course, when we're trying to teach about puberty or safe sex, consensual relationships, that's precisely the age group that we want. And I do think that this is something that there needs to be more discussion on, because of course the rules are there to protect young people. But for instance, we had a huge following on TikTok where, we were getting millions of views on some of our videos, including Tagalog dubbed translations we had of amaze.org videos. And there was one in particular about masturbation. And I guess somebody reported it. And because they reported it, we were then shadow banned. And that meant that for, several weeks, I think it was, they changed the algorithm so people could not see our content. So this definitely, this kind of censorship is something that I think really has to be addressed. And it's tricky because, of course, they'll say that they're trying to protect young people, but there has to be some leeway for educational content that happens to be about sexual and reproductive health.
Anna was talking about using creative names and subtitles and stuff to kind of find a way of being out there. So Faith, do you have any similar experiences on that?
Yes, just to add on to what Amina and Anna just said, for us, just in addition, we have also experienced some opposers generally in the sector who, for example, will get already existing curriculum documentation, which incorporates access to information about, how a young person moves from childhood to adolescence and to adulthood. And those specific words or the entire curriculum was retranslated to show that it's not promoting the use of this language, or that this language is quite inappropriate for young people. And this curriculum, as you know, as a country, we are at a stage where curriculum, the comprehension of sexuality education has been put in one document, and this is shared in schools. It's integrated in different subjects across the learning years of a child or of a young person. So for opposers of the kind of work that we do and many other organizations to then get this information and translate it and make it sound like, oh, these civil society organizations are encouraging our children to, have sex, or encouraging our children to use condoms and things like that, is just some of the examples we've experienced in our work so far.
In Mexico, many opposers saying we are just pushing our kids to have sex. Yeah, totally the same here. Thank you for that, Faith. So there's another question for Anna. What are the challenges faced in creating alliances with community leaders on sexual and reproductive health messaging? Anna?
Bien, creo que la mayor
I
dificultad que
think
tenemos
that the biggest challenge that we face isn't when we're actually connecting or establishing a connection with the community leaders. The real challenge is what comes afterwards. We're talking about, first, we provide the information that's needed, the community leaders support us, and they get our message across. They help us get that message to the community that we want to approach. This could be kids, teenagers, or young adults. But the challenge, or what's difficult, is when these people these communities want to get these services, this dignify response in a responsible way, we see that there's no option for that. Unfortunately, the institutions, the public institutions that have access, it's difficult to see that they have these services being performed in a dignified way. We see that there's no capacitation, we see that there's not enough staff. There are many different reasons that we see these institutions saying that they don't have that. To give an example, let's say that a teenager go to a health center and she or he ask for any preservative or any pill, any simple right to be able to obtain that in order to enjoy your sexual life in a healthy way, we see that these public spaces start making an interrogation. Why do you want this? Are you married? Do you want this? Are you married? Do your parents know that you're going to this health center in order to ask for a condom or for a pill? Like they just challenge them. And when these young teenagers or these young adults face the situation in a public place, we see that it's problematic, and we see that in these communities this shouldn't be like this. So if a 15-year-old teenager goes and asks for a preservative, the community starts talking behind her back. And unfortunately, the public health center have weird rules. I'm gonna speak or mention one situation that we have here in Mujeres Aliadas, which someone goes and asks for any preservatives. In this case, we ask for like a condom, and one of our partners was told 2 months before that she was in a list that mentions her. Oh, she's here. Women who actually request for any preservatives, condoms, or anti-conceptive ways. So this is actually a serious attempt to our privacy in our life. Why are you doing this? Why are you putting on a list that everyone displaces? So these are the things that we see, and because of this, they don't go to these spaces. And this is where we have to continue to making activities in order to provide dignified attention and response to all the women in space where like the midwife can actually supply the needs of not only just the pregnant women, but also the teenagers who require any kind of counseling or help. Unfortunately, we still have limitations based on distance and time. However, this is the biggest challenge that we face, I believe, because we cannot provide a safe and dignified response for all of the teenagers, young ones, children, in order to gain access to these rights that they have and that we continue to mention to them.
Topic on data privacy. So maybe one of you want to comment on this. There's a Susan comment on the mandatory period trackers to track the menstruation cycles of young women, potentially targeting in particular those who may be undocumented or those who want to get abortions, so those who are pregnant. So maybe one of you want to comment a bit more about data privacy that needs to be addressed, protected. What do you think about this? Amina, yes.
I can start. To be honest, I mean, I hope that this won't become a problem for us in the Philippines, but judging from how it has played out in other countries, it probably will. You know, as Holly had pointed out in the chat, the tech companies own the data. And even with what we were talking about with the censorship, you know, the tech companies haven't been very open to having discussions and engagements on this to try to address the concerns. So, you know, in the Philippines, we have a lot of great laws that unfortunately just don't get implemented. We do have a reproductive health law, which hasn't really been implemented, but I would assume that if, for instance, with our CHIS data, if suddenly, you know, the government or somebody else was trying to take that data for some kind of negative intention, I think what we would try to advocate for is to hold on to the laws that we have that protect human rights, that protect data privacy, and you know, focus on those with the advocacy in terms of saying we shouldn't do that, you can't do that. But I think, you know, realistically, if it does, if it happens, I'm not sure that there's so much we can do. And, you know, Susie, you had mentioned that ever since Roe v. Wade was overturned, there has been so much concern about period trackers like Flow and other apps that women use, that, that the government might try to use this to try to prevent someone from accessing any abortion services. And I don't know what is being done in the US to try to combat that, but I would imagine we would try to look around the world to see what has worked in trying to protect that privacy and try to go that way.
We'll need to keep talking about this. Okay, so one other question for Faith, please. What are the gender norms in Zambia that influence sexual and reproductive health information and utilization of services? Please, Faith.
Sure. So Zambia is a country that has, in 1997, was declared a Christian nation. So by that status, it's quite difficult to disassociate gender roles from the status of being a Christian nation. So some of the known gender roles are, of course, the stigma around access to information about sexual reproductive health services. So women are not, or it's like an unwritten rule that women cannot exactly share or speak openly about their sexual reproductive health needs. And this provides a reluctance in seeking services with regards to sexual reproductive health and rights. So for example, in the books and the policies, abortion and care, post-abortion care is legal. However, because of our Christian, our values and our status as a Christian nation, it's not spoken about openly. And there are so many barriers to access information around such things. So yeah, that, and of course, we also have gender roles around the discussion of sex in general, and women are prevented from discussing their sexual needs and this leads to a lack of awareness, accurate information about sexual reproductive health, and the inability to access these services. On top of that, the society is quite patriarchal, especially in the rural areas, where there's a lot of belief that young women or young people do not have information and cannot decide for themselves about their bodies and about their own rights. And so a lot of programming needs to go towards ensuring that accurate information is shared. Young people and young women know their rights, and they have access to information about how they can make autonomous decisions about their bodies.
Another question for Amina. Are there concerns that information gathered could be used negatively to inform border control police in hostile governmental environments? This has to do with data privacy too?
Yeah, I mean, I don't, we haven't seen that happen, and I hope that it doesn't. There had been a question earlier about how did we get kind of government buy-in to support this this new program that we have, because wouldn't it potentially expose the things that they haven't been able to provide. But I think that post-COVID and post the disaster that we went through in Palawan, I think that it made the government more open to having more information, to having more data, even if it might expose their shortcomings, because I think these disasters basically showed them how much there is to do, and how sometimes how little resources they actually have to address these huge problems. So in a weird way, these very negative things that happened actually had this positive effect of making the government more open to trying new approaches to try to address the problems that we're facing. And the government knows that teenage pregnancy or unplanned pregnancy and maternal deaths, complications with pregnancy, they know that these are big problems that they need to address. So thus far, they've been very open to this partnership. But like the question with data privacy, we're just going to have to be very diligent in watching this and making sure that that this data doesn't get taken advantage of.
up, this last question will be for all of you to have your final comments on this. So in such challenging environments, this is a question from Susan, Christian nation, opposers who have nothing better to do than track TikTok videos for adolescents and all. Why do you all continue to have the courage it takes to do what you do so bravely and with such imagination and determination? So that's for our final round of comments. So who wants to start? Maybe Faith?
Sure. Wow, there are so many reasons that make us wake up every day to do this work. I believe that obviously it starts from seeing that there's light at the end of the tunnel. We do have not all, the opposers, or rather not all the barriers are impossible to get over. We do have a lot of other champions and other giants on whom we lean on within the sector to ensure that we continue to do the work that we do. But ultimately, our burning passion to ensure that, as I mentioned, we do envision a world where every young person is happy, healthy, and living to their full potential. And having access to accurate information about their sexual reproductive health and rights is what we wake up every morning to do. So be it through community outreach programs, university campus outreach activities, community mobilization through sport, just ensuring that whatever platforms already exist or whatever areas or whatever sections of communities that we can be able to maximize and ensure that information is shared is utilized effectively to ensure that we are having or we're building a crop of young people that are destined to thrive. And so most of our programming ensures that young people are at the design stage, because that way it's more sustainable and there's a lot more social impact in them providing solutions to the challenges that they face. So whether the opposers, rewrite the curriculum that is supposed to be sharing accurate information, or wake up in the morning and say, hey, we're going to cut integration of comprehensive sexuality education in the curriculum, we will still wake up, we will still show up, we will still bring that youthful energy, and we'll still fight for justice for young people, ensure that young people and young women have information, have access to good quality services, and they can be able to ultimately make decisions about their bodies and about their rights. So yeah, that's what keeps us going.
Thank you so much, Faith. So Amina, please, with your final remarks.
Sure. I mean, echoing what Faith said, my colleagues and I all, we will always keep fighting for the right of women and young people in the Philippines to be able to have their best reproductive health. And one of the things that in particular has kept me going recently is that we started Roots of Health 14 years ago. And in the last 5 years, we've actually seen the number of teen pregnancies in our city go down, even while it has continued to increase in most other places in the Philippines. So this just gives us so much hope to be able to finally see that, wow, our programs are having the difference and making that difference and having that impact that we envisioned so long ago. And it's great to be able to say now to other advocates and other government agencies, and to be able to say, look, when we give young people the information that they need and also give the access to non-judgmental contraceptive services and strengthen the programming by training, the health workers, the teachers, all the gatekeepers for adolescent sexual and reproductive health, we can actually see a difference. We can actually make this change and improve health for all. And that's basically where, what we're focusing on in the years to come is just maintaining this change that's happening in our city and trying to see it happen in other parts of the country as well. And, it's International Women's Day, we can all just be so happy. I know that all of these organizations that are in Women Strong's Learning Lab represented here, that we've all, even though sometimes it can be so depressing because there are still so many problems and they are still such huge problems, it's focusing in on those wins and on the things that we have been able to do successfully, and just trying to replicate that and, do it in more places, share it in other countries, take the learnings from the organizations in different places and apply what is relevant. And, I think so those are some of the things that keep me and my team going.
Muchas gracias, Amina. Y esta última ronda.
Thank you very much, Amina. And last round for Ana. So Susan's question, in these contexts where we have so many counter arguments, what makes you still wake up every morning and be bold enough to still work in this job? Well, I think that in Mujeres Aliadas, for all of us, and as Amina and Faith has already mentioned, the work that we do with our community is essential, but I think we are forgetting about something that really touches me, which is what moves me every single day, is networks. The networks we've created with community leaders. They are my comadres en lucha. That's the term that we use, comadres, which is like our friends in this fight, because it's not always easy to fight in a space where everything is against us. We have the culture, patriarchy, sexism, everything works against us. And it's very difficult to have sustained efforts. So having a network that allows us to work together to get good outcomes, it's really motivational and inspirational, because it allows us to see how more women, more girls, and more adolescents are waking up and are joining the fight and the struggle towards a present and a future in which the rights of women, girls, and adolescents are respected. I think it is truly motivational to really see that in order to defend not only SRHR, but also women's rights and all the rights that we're entitled to, we need to understand that the first struggle space is our body. It is our territory. If we do not know our body and the processes that take place in it, it's truly very difficult to understand everything else that happens, because everything else happens around us. So this is one of the things that we've been working on with our comadres. The body should always be at the center of our struggles. It is the core for our fights, not only for us, but also for all the women in our future and all the girls and adolescents that will be here in the future. Many thanks, Anna, for your takeaway. It is very inspirational. Thank you to all our panelists for reminding us for the importance of being creative, of taking into account the context in which we work, and the importance of measuring what we do and gathering data to advance.
Turn it over to Susan for the closing remarks. To you, Susan.
Yes, thank you so much, Lizelle and Anna and Amina and Faith. So many lessons today that we've learned about how to best reach and serve all communities when providing sexual and reproductive health care. Wow, and your innovation and your determination are so inspiring. So first, just quick, the importance of knowing your communities. Second, being able to adapt and to be innovative in reaching them. Understanding and acknowledging that in any situation, we don't know everything, and being equipped and ready to be fleet and responsive. And then always, fifth thing, learn by doing. What's working, what's not. All in the interests of these organizations' mission, that is reaching more women and girls with life-saving, choice-making services. My own takeaway and our mantra at Women Strong is to never underestimate the wisdom, flexibility, and life-saving responsiveness of local grassroots women-led organizations, which receive so much less funding than larger male-led organizations, but which know truly what their girls, women, and whole communities need, not only to survive, but to thrive. Thank you all so much for attending on this hopeful, very busy International Women's Day. Have a look at these great organizations' links, connect with them during CSW. It's all posted here in the chat. And please feel free to reach out to them and to us at womenstrong.org with any questions you may have and with support for their beautiful work. Thank you once again for joining us. Have a wonderful Women's Day.
Thank you all.
Thank you.
Thank you so much.
Gracias.